The OX40 and OX40 ligand targeting therapies were studied as first-line therapies, meaning that patients who did not respond to topical corticosteroids or topical therapies were eligible for inclusion in these trials. Now, we also saw that there was some allowance in these studies for patients that have been treated with previous therapies as well. This includes, of course, some of the biologic therapies that we think of all the time in our clinic these days. And so I think that you're going to probably see a mix. I think that these therapies definitely are going to be the right first-line choice for some patients. For others that might feel that they want to get a little more experience, they might be used after other systemic therapies. And the nice thing is that we have data for both of these populations. And so I look forward to seeing some more of those sub-analyses to really help us understand what it means to be truly naive or treatment experienced and be treated with drugs like rocatinlimab and amlitelimab. Well, the major challenge is going to be that we don't have real world experience. So these are very, very different drugs than ones we've had before. It's not like we're seeing yet another blocker of the IL-13 pathway. So we have an idea what to expect clinically. I think there's going to be a lot of challenges and growing pains, like with any new therapeutic class when introduced into the real world. And so I really look forward to hearing my colleagues' experiences and my own experiences with integration into real world practice to understand, are these being used as monotherapy? Are they being used as combination therapy? What exactly is the timing that we're expecting in terms of promising our patients for improvement? What exactly are some of the long-term advantages of this therapeutic class compared to others? And where exactly is this going to fit in people that have had therapeutic experience previously in atopic dermatitis? Well, like it or not, you're going to have some basic understanding of the immunology behind the therapies that we have, given that most of them are beginning to increasingly involve slightly more complex pathways. Staying up to date on what's happening in atopic dermatitis is vital, simply given the amount of therapeutic innovation we've seen in this space. So whether it be through reading of publications, going to conferences, trade publications, online videos, you're going to have to find something that works for you, because I think that it's starting to become perhaps like drinking from a fire hose, given how much progress we're making in a disease state that we all see. But we're all in this together. And I think that collectively, we learn pretty quickly once we have new therapies introduced to us in the real world, exactly which ones are going to rise to the top and which ones aren't going to necessarily be that helpful to our patients. I want people to get excited, because at the end of the day, excitement is what drives more innovation. I think understanding that we need more drugs for atopic dermatitis, and every drug is going to have a slightly different home in a different scenario, in a different situation where it's effective for patients, really allows us to have a number of distinct therapies that coexist. So you really have to be into the science, but also understanding that these are all drugs that you have access to in the real world, and you have to try them and use them and figure out the right patients. And by virtue of all of us being able to stay on top of the data and clinical use, we're going to really be able to create a picture of exactly finding the right treatment for the right patient.